EMDR is eye movement desensitization and reprocessing. It was discovered kind of accidentally by a psychologist in New York who was working primarily with Vietnam War veterans. And
What's his name?
Her name is Francine Shapiro. She was working with Vietnam War veterans and with women who'd been raped. She was working with PTSD, with people with flashbacks, nightmares, classic symptoms of PTSD. And around that time, she was doing research, and she also had a diagnosis herself of cancer, I think. And the story goes, she was walking through Central Park thinking about her own personal trauma, and noticed that her eyes were moving from side to side, just kind of spontaneously, I think, and that started to reduce the level of distress she was feeling. So she did research on using eye movement with the population she was doing research with, the patient population. And so EMDR developed. There are various explanations for why it works, none of which I think people are totally satisfied with at the moment. Initially it was thought that it linked to the rapid eye movement you get during dreaming sleep. Because when you do eye movement in therapy, it's rapid, short bursts. And it was thought that the rapid eye movement you get during dreaming sleep linked to processing memory. And that you were stimulating that artificially in a therapy session to begin to move people forward. Other explanations would be that it's connecting the right and left half of the brain as you do some kind of bilateral stimulation, because you can also use headphones with alternate taps just in each ear, or tap the backs of people's hands to create left-right connection across the halves of the brain.